Dr. Zymantas, what's the difference between a veneer and a lumineer? It's a confusion to many of us. Tell us which one is which and what they're good for.
A lumineer is a proprietary little piece of ceramic, meaning a specific company owns the rights to make lumineers, and they have been very good in marketing lumineers. And what it is, some people know a little bit more, especially women, what a Lisle nail is. It's kind of like a Lisle nail that gets glued onto, instead of the finger, this is you take an impression of the teeth, you send it to a laboratory, and the laboratory then can send you back these processed porcelain little slivers that get glued onto your teeth. Sometimes the lumineer, a little bit of a problem is that there's a ledge right at the gum line, and if it's not totally prepared properly, it can lead to gum problems. A regular conventional veneer, the tooth is slightly prepared versus a lumineer where hardly any preparation or no preparation is done.
What do you mean by preparation?
Where you pretty much, let's say, grind down the tooth to allow for the materials to kind of replace whatever was, say a veneer would be used to change the color or the shape of your tooth. If it's not too majorly of a big problem, and you can do that quite readily just by removing a half of a millimeter, say, and allowing the technician a little bit of space, which is that half of a millimeter, to be able to rebuild the tooth to make it look the size and the shape that you would like, and the color.
That's with a lumineer.
That's with a regular veneer. A lumineer pretty much does the same thing. The biggest difference between a lumineer and a conventional veneer is that a lumineer, in most cases, do not need any preparation. It's no shots. For people that are very phobic of shots, may be good. And if there's a lot of very heavy color staining, the very dark teeth, it's not very appropriate for that. If the teeth are very crooked and very, you can't, there's people that go to pretty big extents to change a lot of the bad properties of the bite with a lumineer, and sometimes not quite appropriate because there's too many underlying problems that will cause bigger problems in the future.
Okay. So what makes if you put like one of those fingernails over the tooth, no matter how thin it is, if you don't grind that tooth down, wouldn't that tooth become a fair amount bigger than the other one?
Yeah, that's another issue. Sometimes if you add a half of a millimeter onto the teeth, in some cases, as you move the tooth forward with the veneer, then the width of the tooth is also changing, so the dimensions of the tooth begin to change, and sometimes some people end up with veneers that look rather bulky and not very natural. And again, at the gum line, there's a little ledge, and if that ledge isn't properly taken care of, that ledge can lead to gum disease and red gums and bleeding gums and other issues like that.
Okay. All right. So that was with the veneers. I mean, on the veneers, you can grind the tooth down and make the tooth as big as you want, I assume. But on a lumineer, if you just glue something on it, on an existing tooth, no matter what, it becomes bigger than before, no?
Correct. It becomes, you have a little bit of a bigger dimension of your tooth than before. And for some people, it is an issue of thickness. Their lip seems to kind of hang up on the veneer. It's like because of the bulkiness, and again, from the width of the tooth begins to be a little bit wider. So again, your teeth with the lumineer may possibly start looking more more kind of bulbous, and again, not very natural looking.
Especially if you do only one, I suppose.
Oh yeah, it's very difficult to do. I'm not even sure. Some people probably try it and do it, but doing one tooth with one Lumineer isn't really very possible without preparing the teeth. And if you're going to prepare the teeth, then you might as well do a normal, regular type of veneer.
Got it. All right. Thanks.